Uses. This medication is a multivitamin product used to treat or prevent vitamin deficiency due to poor diet, certain illnesses, or during pregnancy. Vitamins are important building blocks of the body and help keep you in good health. How to use A Thru Z Select oral. Take this medication by mouth, usually once daily or as directed. Follow all directions on the product package, or take as directed by your doctor. Do not take more than the recommended dosage. If you have any questions, ask your doctor or pharmacist. Take this medication regularly in order to get the most benefit from it. To help you remember, take it at the same time each day. Side effects. Constipation, diarrhea, or upset stomach may occur. These effects are usually temporary and may disappear as your body adjusts to this medication. If any of these effects persist or worsen, contact your doctor or pharmacist promptly. If your doctor has prescribed this medication, remember that your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. A very serious allergic reaction to this drug is rare. However, seek immediate medical attention if you notice any of the following symptoms of a serious allergic reaction: rash, itching, swelling, especially of the face, tongue, throat, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Precautions. Before taking this product, tell your doctor or pharmacist if you are allergic to any of its ingredients, or to soy or peanut found in some brands, or if you have any other allergies. This product may contain inactive ingredients, which can cause allergic reactions or other problems. Talk to your pharmacist for more details. Before taking this medication, tell your doctor or pharmacist your medical history, especially of abuse of alcohol, liver problems, stomach, intestinal problems, example, ulcer, colitis. If your brand of multivitamin also contains folic acid, be sure to tell your doctor or pharmacist if you have vitamin B12 deficiency, pernicious anemia before taking it. Folic acid may affect certain laboratory tests for vitamin B12 deficiency without treating this anemia. Untreated vitamin B12 deficiency may result in serious nerve problems, example, peripheral neuropathy. Consult your doctor or pharmacist for details. Tell your doctor if you are pregnant before using this medication. This medication passes into breast milk. Consult your doctor before breastfeeding. Interactions. Drug interactions may change how your medications work or increase your risk for serious side effects. This document does not contain all possible drug interactions. Keep a list of all the products you use, including prescription and non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug are other vitamin nutritional supplements. If your brand of multivitamin also contains iron, avoid taking this product at the same time as antacids, bisphosphonates, for example, alendronate, levodopa, thyroid medications, for example, levothyroxine, or some antibiotics, for example, tetracyclines, quinolones such as ciprofloxacin. Ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If your brand of multivitamin also contains folic acid, be sure to tell your doctor or pharmacist if you take certain anti-seizure drugs, including hydantoins such as phenytoin. This medication may interfere with certain lab tests, possibly causing false test results. Make sure lab personnel and all your doctors know you use this drug. Overdose. If someone has overdosed and has serious symptoms such as passing out or trouble breathing, call 911. Otherwise, call a poison control center right away. U.S. residents can call their local poison control center at 1-800-222-1222. Canada residents can call a provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, diarrhea. Notes: if your doctor has prescribed this medication, do not share it with others. Keep all regular medical and laboratory appointments. Some brands may also contain ingredients such as docusate. Ask your doctor or pharmacist if you have questions about the ingredients in your brand. This product is not a substitute for a proper diet. Remember that it is best to get your vitamins from healthy foods. Maintain a well-balanced diet and follow any dietary guidelines as directed by your doctor. Miss dose. If you are taking this product on a prescribed schedule and miss a dose, take it as soon as you remember. If it is near the time of the next dose, skip the missed dose. Take your next dose at the regular time. Do not double the dose to catch up. Storage. Store at room temperature between 59-86 degrees Fahrenheit, 15-30 degrees Celsius away from light and moisture. Do not store in the bathroom. Keep all medicines away from children and pets. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. Properly discard this product when it is expired or no longer needed. Consult your pharmacist or local waste disposal company for more details about how to safely discard your product.